country, we are sort of used to doing curative medicine, which is to cure diseases instead of looking at how to prevent them. So we have the national policy looks at government, largely policy. We also want to improve the socio-economic policy. We also want to improve the socio-economic status of the population, of course, through the health delivery system. Ensure sustainable health financing. So we also have universal access to better and efficient mortality and disabilities. And we're looking at increasing access to responsive clinical and public health emergencies. Of course, again, like I said, like the Mpox disease. We have the 2022-2025 Health Sector Medium-Term Development Plan with the following objectives to ensure sustainable, affordable, equitable, easily accessible health care, reduce morbidity and mortality, intensify prevention and control of non-communicable disease. And here, I think the three main ones are hypertension and diabetes, cancers, both adult cancers and childhood cancers, and organ diseases like kidney disease and liver disease. Enhance efficiency in governance and management. So we've also launched a national infection prevention and control strategy, and here we are looking at preventing to prevent, reduce, and control hospital-acquired infections. In the past, we referred to them as nosocomial infections. I guess the word was big, so now we have a new term, HAIs. A situation where you give antibiotics and they don't work because they've been abused. It's a big issue, and we have launched this policy to look at how to reduce the frequency of that. We also have launched the health financing strategy, which has the major objective of contributing to achieving improved health outcomes, financial risk protection, consumer responsiveness, and access to quality, essential healthcare and population-based service for all. And here, let me say that Ghana is supposed to transition to fully pay for some of the commodities or drugs that we get with the help of our partners, like HIV medicines, malaria medicines, and others. And to be able to finance these ones over the next few years, by 2032 or so, Ghana is supposed to fully fund these ones. We need to have a financing strategy, otherwise we might have some issues. So we also have the COVID-19 test to treat strategy, and because COVID is no more health emergency, I think it's important to note that this strategy is there to make sure we continue to monitor our borders, to do surveillance, continue to check to see those who are getting COVID, and to see whether we still have it below the threshold that we want it. And so we have that strategy as well. Interestingly, a lot of people don't know that in our public institutions, we have herbal units. And so it's not all herbal medicine or practice that, in quote, is dangerous. We have well-trained herbal practitioners in our hospitals who dispense medicines that have been tested in our labs and are safe for consumption. And so the objective of this medicine list for NHIS coverage is to ensure access to safe and efficacious herbal medicine. As we speak currently, all the medicines that health insurance pays for, they don't include the herbal medicines. And so when I was at NHIS, we worked with the ministry to include at least some for herbal medicines as well. That is very, very important. So we have some of the help. We highlight some key financial project that has been there since 2017. And ladies and gentlemen, it is good news to say that Ghana has most of its hospitals now connected through an IT system that allows data and history or information of patients to be taken and put on computers and laptops instead of to be written in folders. And we all have had the occasion to be in government hospitals before. prior to see the doctor. In Kolebu now, sometimes when we say these things, people assume it's happening in small hospitals. In Kolebu Teaching Hospital, nobody takes your history with a pen and paper anymore. All your data is on a computer. And by the time the nurse has a tablet that has all your data. And so we have done a significant job to network these hospitals. And if you are transferred from Central Regional Hospital to Kolebu, teaching hospital, you don't carry a folder. You just have to give your ID number, and the system has all your data. And this has helped a lot to improve access to the doctor and health delivery. So this project has the objectives of optimizing the business process to enhance cost saving, improve systems, and to harmonize them, and to allow hospitals to talk to each other. It's very, very important. So the project scope, each facility is provided with a, so we've given to the hospital servers, desktop computers, laptops, and tablets. And the LHIMS refers to the Light Wave Health Information Management System. It is this that we refer to as the e-health project. It comes with training as well. And it is refreshing to know that 99.8% of hospital level facilities are now operational, and 47.8 million patient visits recorded. And this system also allows the hospitals to track their revenues and to avoid some of the revenue losses. So cost savings, surveillance. So in Ghana this morning, if across the country, out of let's say 50,000 visits, 40,000 are realized to have had signs and symptoms that look similar and point to a particular disease, immediately it's a red flag. And real time, the Ministry of Health, and for that matter, Ghana Health Service, can immediately tell that something is happening in the country and we can move to address it promptly. Unlike in the past, where the one sitting at Chebi Government Hospital and the one at Sola District Hospital are not talking to each other. So we can have a serious health threat and we don't know that something is happening. So these are some of the advantages also with the e-health system. So we also have the National Health Insurance Authority, which most of us are conversant with. And with the National Health Insurance Authority, I only say two things. Before we came into office, and then when I say we, before this administration came, most of the hospitals, as for government hospitals, usually they would do their best to work with health insurance, even if there are challenges or not. But most of the private hospitals would prefer to have an agreement with most of the private hospitals will prefer to have some agreement with private health insurance and not National Health Insurance Scheme. Because when you take care of people, it will take a year before you get paid under the erstwhile administration scheme, because we pay promptly. And the interesting thing is that for the first time in many years, the private health providers, those who run private hospitals, issued a statement and said that insurance providers, the companies, and that they rather were not being as reliable as NHIS. This is not to cast any doubt on our friends or partners who are into private health insurance. I believe it's not all of them who are having challenges. But the point is that there's been very, very important, is that from President Rawlings's time, since we started the Fourth Republic, till President Akufo-Addo came, any and every Ghanaian who had kidney disease in the past paid for himself or herself until they either passed away and left us, or whilst they are here in this country. Advocacy is good. With the help of the media, civil society, all of us, we've thrown light on the challenge of kidney patients. And I'm happy that this government, typical of its nature as a listening government, as we speak now, all kidney patients in this country who are 18 years is paid for by this particular government through the National Health Insurance Scheme. And there's another bit which the NHIS has not communicated well. The average kidney patient receives about 4 sessions a month. All these 4 sessions are being paid for by NHIS for those 18 years below and those 60 and above. For those in between, currently, the NHIS is paying for 2 sessions out of the 4 sessions. And so it means that every kidney patient has received either full reimbursement or support or some subsidy from this government. It's the first time since the Fourth Republic that the government has intervened or gotten involved with paying for kidney care in this country. It's the first time. It's not only kidney care. If you have a relative who has sickle cell, you can ask them about hydroxyurea. This is a very important medicine that helps sickle cell patients to live a life which is close to those of us who don't have sickle cell. That medicine helps them to have less crisis events. Crisis means they have severe pain, they can't go to work, sometimes it's hell for them. This medicine, through GOG, government direct engagement with the manufacturer of this drug, settled on an amount that will be paid for. And since the past 5 or 6 years, if my memory serves me right, government has been reimbursing for hydroxyurea. It was not paid for before we came. And as for childhood cancers, I think most of you know what this government has done. Because I was at NHIS, I can also say that for the first time since we entered the Fourth Republic, government has taken steps. Let me take this opportunity to encourage the board of the NHIS to quickly move to make it a reality. Whilst I was at NHIS, our team that looks at benefits and how to codify them, to look at how much we pay for, has codified the 4, I think, most common mental health conditions in Ghana, including bipolar, depression, and I think with these mental health conditions, the state will pay for these conditions. As we speak now, Ghana, since President Rawlings, and I don't want to start from Nkrumah, I always use the Fourth Republic, has never paid for mental health. We have a vertical program that on paper is supposed to pay for the medicines that mental patients get. But since I started practice in 2009, my belief is, gentlemen, the technology, the efforts to formalize this country, just like we have elsewhere in other jurisdictions, some people call it developed countries, the efforts has been very tremendous. And so until this government came, you cannot ask a manager or a worker before you are put on a scheme. Now, with the help of the Ghana card, if you download my NHIS app in the comfort of your room, if you get a message that gives you a digital NHIS card with your Ghana card picture and all your details right on it, you don't need to go to anybody. And if you are 70 and above, instantly you can walk to a hospital and get care without paying 1 Ghana cedis. Far when it comes to access and some of these procedures. I remember somewhere in 2013 when I was at Kibi Government Hospital, renew before they come to the hospital. Now with *929#, is that not it? You can quickly check your status and pay on your phone. After that is affected. To our orthodox medicine, and I think I've mentioned that. Human resource for health. I think I wouldn't bother you with the details, but just to say that this government has put in a lot of effort to make sure that over 15,000 health workers, nurses. But my data, which I'll share with you, shows that from 2017 to date, those that we've put on government payroll, we are looking at over 21,000 health workers, from physician assistants to medical doctors to more opportunities. But the fact, 3,000 plus health workers. And by the way, those that are employed as non-GOG staff, they are not in this data. So when I was board chairman for Kolebu, you have thousands of nurses, thousands of other health workers who are paid for from red. So I think when we add all these numbers, there's opportunity. Today is not mainly Agenda 111. Although all those facilities become operational, we are looking at an average of 60,000 Ghanaians working in these over 111 health facilities. Remember, it's not only factories that create jobs. In hospitals, you also create jobs. And so access will be improved, but sustainable jobs would also come along. Migration of health workers. Cuba that have sent them here. They have trained enough doctors to keep at home and to give to the rest of the world. At the Ministry of Health, we've done a labor analysis. I'm happy that my director HR is here. The data shows clearly that Ghana is producing more nurses than it requires. We are churning out an average of 55,000 plus nurses annually. Anytime you have more than you need, you have to be innovative and find a way to give opportunities to your nurses. And so at the Ministry of Health, I know some of you are aware that Ghana has nurses in certain countries that have been arranged properly between government of Ghana and the Republic of Barbados. As we speak, by October ending, the third batch of Ghanaians would leave for Barbados. And so it is our prayer that we quickly, under this government, act to make sure that if you are trained in this country, either you are absorbed internally or you are absorbed externally. And Ghanaians have come to the place where we can take on the world. We should not train to take on only the 16 regions in this country. I'm happy to say that the Republic or the island of Seychelles have come to Barbados. And so Jamaica, Seychelles, Germany, UK, all these countries, as we speak, are working with Ghana to make it can also help our economy to move forward. In fact, at the nursing health training institutions, which is the HTI, a unit under the Ministry of Health, we are also working to revise our curriculum. If a nurse is trained in Ghana, they should be able to sit in a plane with the structure of government of Ghana, and the next day when they arrive in UK, they should start working in their hospitals. Currently, what happens is that any nurse or most nurses who find themselves in other countries have to go to school again for some 6 months or 1 year to be able to adjust. We should get to the place where you can move into other jurisdictions. And by the way, it's not only health workers who are being trained to be fit for the world. Teachers in this country now, if you check with education, are now teaching in China. We have to move with the speed of the world now. We should look at how to give opportunities globally. But let me end by saying government will continue to work on giving opportunities to our people internally. That is absolutely crucial. So the Food and Drugs Authority, I wouldn't like to worry you too much, but you should know that your beloved Ghana has one of the best regulatory bodies when it comes to the FDA, the regulation of food and medicines. And other countries come here regularly to be trained, working to become level 4. When you get to level 4, right in your country, you can even give the permission or approval for vaccines to be produced. Currently, even if we want to produce a vaccine here, we must go to the FDA of the US, UK, before we can produce in our own country. We are working on these ones as well. Zipline. And when it comes to supply of logistics using drones, again, this is one of the classical examples where when my man says it is possible, it is really possible. Some few years ago, we were told that it's possible to have medicine you need. I worked in China, a woman who is bleeding, can be dropped in the hospital compound using a drone. A few years ago, some said it's very difficult. In Ghana, I think it's a challenge. But as we speak, we call it drugs at reach hospital. But when you go just outside Accra, most facilities in corners where it takes an hour or two for a vehicle to get to them, when they need medicine, they call the Zipline Logistics Center. I need oxytocin. I want to inject a woman. And within 10-15 minutes, they drop the drug in your compound and the nurse goes to pick it up. In the absence of this Zipline drone technology, either you put the patient in an ambulance from Chebi to go to the Koforidua hospital, or you put the woman in an ambulance, and I'm happy that centers, and then the map of Ghana, if you draw it on paper, every part of Ghana, when you call, they can drop a drug which you need. And it's not only drugs. blood products can also be dropped. And when I say blood products, if unfortunately and they need drug to be transfused, they can call a zipline delivery center where you have fridges for blood, some medicines, and they can process and go and drop it near where your relative is. In Ghana, this is happening. For those who practice in Accra and Kumasi, and it is important that we celebrate some of our achievements. Ghana, your own beloved Ghana, went to the US to pick this technology. But as we speak, when I was in Parliament, I was on the health committee. We traveled to Rwanda to learn from how Rwanda was using drones through zipline. But Rwanda had, I think, 2 centers or so. They weren't covering the whole country. Today, in the whole world, even Rwanda is now behind Ghana. We who went to learn from Ghana. And when Kamala Harris gave a speech and mentioned that, I had health workers who called me and said, is what she's saying, what the US vice was talking about, is it true? Some health workers called me. It only reminds us that we need to talk about our own, and we need to visit for the media. Visit some of these centers. You'll be amazed how a drone will be flown and will get it right and drop a product in a hospital center. A lot of products have been delivered. I don't want to belabor you with it. So this is the one. But the drone centers act as mini labs and mini blood centers. And it's a good way to make sure that when we are in trouble, we can get help. I'm happy that Dr. Kumabwaji is here. All the viruses in town, if you have questions, he would, I'll say, although not perfect, has seen some significant support in this administration. Sometimes it's easy to criticize what you have now and forget where you are coming from. Before, we had close to 307 Mercedes-Benz Sprinter ambulances commissioned at the Independence Square. If you talk to the National Ambulance Service, the ambulances that were on the road from Accra all the way to, Burkina border, were not up to 60. But that there is one problem that I knew about Ghana Ambulance Service way back before Akufo-Addo became president. The ambulance driver will tell you, doctor, something small for fuel. Over the years, that practice has gone down, but we still get reports of it happening. We are working hard to make sure that in this country, it is possible to have an ambulance service that comes for you without checking who you are even working with. That is what we are working towards. It is possible to get that done. And the Ministry of Health will work with all stakeholders so that we get that done. We have some new ambulances that have also come. I know if I go on and on with ambulances, you ask me more questions on some of the ambulance issues. So let me move on to, yes, and I'm happy that now we are coming to infrastructure. So we have the ambulance training school where we train our emergency physicians and the paramedics. We have some projects going on to give them the necessary infrastructure. Ladies and gentlemen, this is where we'll be presenting the last chapter of today's issues. I think we're going to handle health policies, look at financial assets, which talk about the drone delivery and fiscal assets. Because Agenda 111 has had a lot of attention, people assume that beyond Agenda 111, this government has not built any hospital. That is quite sad. There were many who were born before Agenda 111, and some of them would be unveiled or mentioned here. And so, NMS Infrastructure is a company that have completed Dodowa and Fomina, Kumewu, Takrady European flats. I know Fomina and Kumewu were started before % completed their hospital. The chief of to meet. If you are here and anybody creates the impression that Fomina was about 35% complete, the Akufo-Addo government found the resources and the energy to make sure that Formina is completed. If my memory serves me right, I think Dodowa was completed before we came, right? Yes. So this is a company that had all these projects. One was completed. When we came, we have completed the others. And I know that they had it on their books to work on Abetifi and a few others. There were challenges. Even before we came, this contractor had challenges with the government of Ghana. There are letters from my senior then, Honorable Segbefia, pointing out some of the issues with the contractor. But we sat down, the Attorney General with the Ministry of Health, and I'm happy that they've completed some of these hospitals. We'll do whatever we can so that others that also have their footprints also get their hospital completed. Ladies and gentlemen, we've also completed 7 district hospitals at various facilities. I've mentioned Kumewu District Hospital. So these are pictures of Kumewu in the Ashanti region. And so we have this contractor, Messrs. Contractor, that worked on these 4 facilities. For those of us who know Tetekwashi, they received some facelift under this government. When you go there, the staff will tell you a lot of things have changed. Etibie as well, Ebri as well, and Kibi or Chebi, as you might put it, at a cost of 40 million euros. For those who say that, where has all the money gone? Just these 4 facilities. This Akufo-Addo Bawumia government has invested for 40 million euros. And I'm happy to say that the last time when I visited the Kibi Government Hospital, it's better than what I met somewhere in 2012. So these are some of the pictures that my team managed to get of the refurbishment and some of the inside pictures of the units that had attention. All these slides will be given to you, so sometimes I'll move with speed. So a few weeks ago, I was privileged to be in Bolga to commission the phase 2 of the Bolga Hospital at a cost of $20 million with the help of the Saudi fund. And those who live in some 8 years ago is not what is there today. And when we talk about progress, progress is steady and continuous. And Bolga is also an example of what the Akufo-Addo is doing. And by the way, for the first time, Bolga Hospital has a CT scan that is functional and in operation. Someone will say, but what is the big deal? Before Akufo-Addo came, if you get a severe stroke and the doctor wants to know the kind of stroke, whether it's a bleed or a clot, you need to know which one before you know which medicine to give. They have to put you in an ambulance and drive to Tamale Teaching Hospital to take a picture so that you go back to Bolga for the doctor to know whether to give you. If the doctor, but sometimes, if it's very bad, the doctor must play some, I would not say lotto, but you have to gauge. The patient is unconscious and all that, it's likely to be a bleed. So give something to stop the bleeding. Now, what stops bleeding is supposed to form a clot. If the doctor misses the guess and it's a clot that you have, you get more clots. So these are little things that make the whole difference in the world. Bolga has a functioning CT scan under this government. So these are some of the pictures. It also came with staff accommodation, and I believe that we will get there. We will get there as a country. So these are pictures of Bolga. Excellent. So as we speak today, we have a new urology and nephrology center which has been commissioned, which is about to be commissioned by this government. I remember 2020, all the plans were ready. And let me say that as board chairman for the Kolebu Teaching Hospital then, somewhere I think 2018, before we came, under the previous government, there were plans to build a urology center. What does urology do? This urology is the field of medicine that deals with all things that have to do with urinary tract. For men, as men age, sometimes they get prostate issues. They need to do surgery. If it has to do with urination, urology is the answer. Ladies and gentlemen, before the Akufo-Addo government was going to partner a private organization to build in Korle Bu a urology center which will operate like a private facility and share revenues with Korle Bu. The money was not going to be paid for by GOG. So when I was board chair, the conversation was activated that if you should go by this arrangement to a fully funded EPC arrangement where you have the procurement, the construction, everything paid for by the government of Ghana through a facility. And I can say proudly that this new center, which we will commission in a few weeks, is the property of the government and not commercial rates. I was also glad that when the facility was tested, this is an ultra-modern hospital. Friends in Korle Bu should not be worried as unfortunately. I wish this was sited on its own compound, where the men can go for their things in peace. But it's been sited on Korle Bu land. So, recently when it was tested, an honorable member of parliament in Ghana's parliament now, on his prostate at this facility. And my report shows that everything is fine. His wife is happy. The procedure went well. So this is a urology center. This is an ultra-modern facility. And let me give you a practical reason why these things make a lot of difference in the lives of Ghanaians, ordinary Ghanaians. If you have a prostate problem and they have to operate on you at Korle Bu, because you have the theater block having, let's say, 10 abdominal surgery, using it to do other surgeries. Those who work on the prostate can be given, let's say, only 1 day in a week. So they will tell you, oh, this is your prostate. We wish we could do it for you. We are ready. But the theater gives us one space in a week. So we are in September. Please come first week in March. So if you're a man, you have to do with a catheter till March. Now that urology have their own facility and the number of prompt. Yes, so the center has a capacity of 101 beds, 70 beds for urology, 51 beds for nephrology. And the nephrology, we mean dialysis. And so hopefully in the next few months, all this noise about dialysis space, we don't have machines, is going to be a thing of the past. We are going to have 51 beds for dialysis, ultramodern, sustainable. So urology are going to have 2 theaters for themselves. 24 hours, 7 days a week. By the way, so this is investment into the life of the ordinary Ghanaian. The old man walking the streets of Tribla in Teshi who has prostate issues. When he walks to Korle Bu and now enters a new facility, his prostate is done with. When he walks out, he knows that Ghana is going somewhere. And I'm also happy that this facility have a conference room. In fact, not one, there are 2 or 3, like this, where all students and doctors can be watching the procedure live on TV, on the screen, so that you can learn. Some of them into the theater. And if you are not tall, you are in trouble. You can't see what is happening. We built a lot of them when COVID struck, or in the process of COVID going away. Most of them are more or less mini hospitals. They have an emergency unit. They have an ICU. Because COVID is not at a level as a public health emergency, most of them are serving as adjunct hospitals, meaning they are providing beds to add on to the hospitals that they are close to. And some of them, not some, all of them have sophisticated equipment more than the big brothers that they are patching, the main hospitals. And it's important to go through. Sewia, so you have a treatment center next to the Sewia hospital. Sewia is in Ashanti. It's a regional hospital. Everything is done. We are working speedily to make sure that it is operationalized next month. And let me thank Dr. Nsiasari. He's been very key in supporting, working with us to get this done. They had some major issues with the transformer that had to be Boku Prempe and Herbert Kappa, the new one. We've moved to put in the energy, fix the energy issues. Legend Hospital, Zebula, you have a treatment center there. You also have, and I know we are on GTV, so those who are watching, greetings to those who are watching across the country. Just pass by the facility that has been captured and let us have feedback. Sevilla, 100% completion is not be operationalized because of power issues. We are working speedily to make sure that it is operationalized. This is a 250-bed facility that has been completed by this government. It has all the facilities that you expect. In fact, the Omayini for the town, very active, nearly arrested us for not prompting him before we got into the facility. This hospital. So the Ministry of Health has also procured a number of equipments for Koforidua, the regional hospital, Tamale Teaching Hospital, Ho, Cape Coast, and all that. These are one compounds, and I know many more communities need cheap compounds. We are going to work to make sure that in this country, you should be able to walk to a health facility. We shouldn't always drive to go to the clinic. It is possible to have that done in this country. We've also had, let me move from the cheap compounds to ongoing projects. So ladies and gentlemen, the Konfanoche Teaching Hospital. This is a project that cost 138.5 million euros. For those who have been asking, what have they used the money for? And in fact, we had to do this, meet the press, because of facilities like this. Because I schooled in the Konfanoche Teaching Hospital. And I realized that some of my colleagues stay in, even Manshia don't know that this facility is being built. The worst part is that I met a friend who is at the ONG unit. This is a maternity and child block. It's more or less a hospital on its own. And some of my colleagues in the ONG unit in Konfanoche have not gone to see that this is what we are doing for them. And I'm happy to say that this was an old block best, but they couldn't get onto the compound to reactivate the project. Either it looked too big or it appeared impossible. But with this administration, you can see that it is possible. So ladies and gentlemen, this huge facility cost less than 50 million euros in the Ashanti region. For those who say that Ashanti region is who is moving with speed to finish it. Because of the debt exchange program, work stopped for some time. But I'm happy to announce that work has started. Yesterday, we had a meeting with a consultant, and by the time this facility is completed, hopefully in the next 24 months or so, it's likely that I'll go back to Konfanoche to do some practice whilst mixing it. So we also we've had Eastern Regional Hospital in Kof. When I went to their labor wards, all the labor wards were air conditioned. Sometimes we have to point out public facilities that behave like private facilities. So, good morning to all midwives, senior in charges at labor ward at Koforidua. When I saw the awards, I felt like having my partner go to deliver again. Someone would have said that is enough. But this government has had the courage, beyond that facility, to build a new ultra-modern Eastern Regional Hospital with state-of-the-art facilities. Most of these facilities you see in the hospital, it is not planned from day one to be a regional hospital and to serve the region. So, at the cost of 70 million euros, this government, when you are driving from Koforidua on the way that goes to Suhum, you see a huge block. Unfortunately, by the government, work has been reactivated on this project. And good morning to all those in the Eastern region. We are going to have one of the finest ultra-modern hospitals in this country. And that also, from my data, has over, I think, 200 beds, 250 beds. It's a very modern hospital. Huge investments that we've made in the health sector. And so that is the facility that you have at the Eastern Regional. I pass by the place, but because I don't enter the town here. So we also have rehabilitation of Efian Kwanta Hospital and construction of a new Western Hospital. And again, this speaks to the courage of this government. I use the word courage. Efian Kwanta on paper is a regional hospital for Western Region. I say on paper. Because if you go there, some district hospitals have big muscles than Efian Kwanta. But for the first time, we had an administration that has been bold to say that we would redo this hospital, more or less. So at a cost of about 90 million euros, I'm splitting into the new one and the old one. So the 190, you are talking about 90 million euros to build a new hospital within the current premises, Efian Kwanta. And I visited that some few weeks ago. And these are some of the pictures. This hospital has everything you can ask for, about 250 beds. It has theaters for obstetrics. It has a whole floor for theaters for surgery. It has everything in a modern hospital. But I talk about courage because the Kufuor government didn't only dare to build a new one. They said, let's have another one at Apimenim within the Western region so that there can be sufficiency and there can be real access when it comes to accessing hospitals. That one is also at an average cost of 90 million euros. So this is the courage I'm speaking to. When others have tried to manage with one which is a cake, an administration comes and says that we are doing two at the same time. And I'm happy that although the debt exchange program, because of the facility we were using, sort of impacted on the work speed, the one at Efian Kwanta proper has moved as expected. It is the Apimenim one, every challenge you see that you encounter to avoid challenges or not to experience challenges is the capacity to deal with them that we are interested in. And let me thank Honorable Mesa, Madam Eva Mens, all the people in the Western region, the medical soup. There are people who I'm happy that they have fought a good fight. And today, they are part of these legacy projects. It is possible to also complete them. These are all those watching from Tadi. So you can see this. I joined the workers to do some action. As a Winsu Treatment Center, we also have that. This section, I want to, as for the treatment centers, we've done so many. We'll give you the details. I want to focus on the big ones like the Eastern Treatment Centers. Well, I visited Kolebu, those watching from Kolegono. A lot of things. So, let's come to, because I met some guys in that area, and they spoke in Ghana, doctor, one akonoko means they've not seen anything. Apparently, they've not entered the hospital environment. La General Hospital. Ladies and gentlemen, the last hospital I worked in before going to Parliament was La General Hospital. Great slab will fall, hit the ground whilst you're on ward rounds. When I entered Parliament, any organization that I had a relationship with, when I went to Parliament, I didn't leave them to where I am now. I always get close to see how I can use my offices and influence to support. So I visited management of La General. Any news that we are all gone. And so whilst I was MP, 2017, I engineered a visit to La General Hospital with Mrs. Baumia, Samira. So I have all kinds of tricks I use to get work done. Then we went to give things to projects. The second lady has this civil society NGO that uses to bless women and children. So I told her, Madam, let's go to La General. I knew why we were going there. She didn't know. So when we got there, management said their number one problem is that La General was a death trap. Doctors and nurses in La General. And so I was the servant who takes feedback from our visits with Mrs. Baumia. So I took it to Honorable Ajimamenu, my former boss and predecessor. Honorable Henry Quarte and others. And then through our lobbying, they got a company to come and do structural audit of La General Hospital. The audit report showed that hospital should have gone down years ago. It's a death trap. And again, with our audit report, share with the public. And I guess because either it's bureaucracy or civil service, the report didn't come. So when he had no plan to build one for them, part of the 7th Parliament, and we approved a loan that was to pay for the construction of the La General Hospital. But because of the debt exchange program, many finance houses, when we got into the global financial crisis, they pulled away from arrangements. And that's why La General stalled. President Kufuor called Ministry of Health, Finance, and said, if debt exchange will slow it, we have to find money and pay from GOG. And I'm happy to announce that La General now is being built from coffers. When I visited the La Traditional Council and told them, 7.5 years. We have been with your predecessor. But I thank God that Finance Minister, Honorable Amin, with support from Cabinet and President Kufuor, got money released to the contractor. And when you drive by La General today, you will get to know that when the Kufuor tells you, I'm going to work on a project, he means it. It's not a story. And recently, the La chiefs, the La traditional authorities, one of them called me. We went there a few days ago with Dr. Bami. I said, Dr. Kam, in Ghana, you came here to tell us it was not a fluke. We can see. When are you coming back? So that La General, it is possible. Ladies and gentlemen, so La General is going up with speed. It's going to have one of the finest hospitals in Accra. One of the finest hospitals. And this is the building. This one is actually the accommodation block. So La General is not only a hospital, it's also going to have accommodation. When we're there, everybody for himself. Nobody sleeps in that hospital. Of course, we had a mortuary there, so maybe it's for the dead. So let me go to, I think there's one more, and then maybe we can go to the Q&A session. Central Medical Stores in Kraza and Doma. This package had challenges because of the debt exchange. And so when you go to Tema General, you see some of the pillars, but the work has stalled. Ladies and gentlemen, like President Kufuor said, for those who die, we can't go back and bring them up. But for projects that stall, we can work our way out and reactivate them. And that's what it meant by we know how to bring back the economy. As we work on this economy to go full speed, just as La General has been reactivated, Eastern Regional Hospital has been reactivated. Our friends at Tema General go to these are 12 hospitals. Ladies and gentlemen, these are 12 hospitals that were started in 2021. And I don't want to repeat who was handling government or in charge of this country in 2021. For those who say not as parts of this country. And I'm happy that at least I went to Suame to see Suame's hospital. Anything you get in a hospital in Berlin, Hamburg, Madrid is at Suame. Mim, Pon Katamansu, Chudie, Achasi, Suame, Nkwetia, Edukrom, all at a cost of 71 million euros by a very good contractor, Vamed. I call them good because my experience with them, they deliver on schedule. So these are the facilities. And although you see 95, 94, they are actually completed. They are referring to accessory facilities. Sometimes a road dam must be graded and all that. And I'm happy to say that all these facilities, Ghanaians must enter them before the end of this year. So that's a Dukrom facility in the Eastern region. Pon Katamanso. As for Pon Katamanso, greetings. When we went there in 2020 to cut short, someone told us that we've seen this for years. They thought it was impossible. And then now, every morning, they go and check how the place is doing. I'll be coming there myself to check it out. Pon Katamanso in Greater Accra. it's done. So these are some of them. And although you see them, they look like medium-sized hospitals. They have all the things you need in a basic hospital. All the things you need for a doctor to be able to save a life. From cesarean sections to hernia operations to dealing with heart, all the things that you need. And for those who are watching, MIM, well, Suame, I was in Suame, Drobonso, Masun Kwanta, all these hospitals, Chudie, across Ghana, all these are outside Agenda 101. Agenda 101 was born recently. We also have this project. So, good morning to our friends in Obuasi and in Inem. They will speak to these facilities that the Akufo-Addo Bawumia government has invested in. So this is Obuasi trauma, about 55%. We'll move to complete that one as well. And Obuasi Health Center. So this NJC government hospital, 92%. When you see 90 plus, it tells you that we are doing finishing touches. And that it has become... The last time I visited a church in my constituency. I told one man, it is possible. He said, Doc, you have to shift from it is possible to it is done. When you see 92% plus, it is actually done. So we also have some primary health facilities. And this one is very interesting. Since the Fourth Republic, in the whole of Accra, population of 6 million, largely we have only one children's hospital, Princess Marie Louis. They recently wrote to me, DG, the health minister, that they were going to go on strike. They will wear red band because the hospital, this good morning to them. After DG intervened for me, they have calmed down. That Princess Marie Louis, it was built, I'm sure, of the Greater Accra region. The only president who had the courage to build a new one is Nana Addo Dankwa Akufo-Addo. So when you go to Weja, Bawe, municipal, what they refer to as Akawe, is that not it? You see a huge building next to it, and I think the pictures are on the screen. This is an ultra-modern 120-bed children's hospital that is being built, and we are working with speed to make sure that before the end of this year, those in Princess Marie Louis relocate to the new Weja Municipal Children's Hospital before the end of this year. And I went there. The facility is so amazing that I picked intelligence that some of the health years and above or below, we are not going to agree. It's for children. It's going to remain for children. And it will be protected for children. So we also have some infectious disease, a training center for infectious disease at Pantam. I've seen these structures. I wouldn't like to, we have to move to the next session. So ladies and gentlemen, I thank you very much for your attention, and we'll move to the Q&A. Thank you very much. I see that.
Thank you so much, Honorable Minister. But I believe before the Q&A, I'm informed there is a very short video that the crew would like to show, if it is ready. If not, we'll move to the Q&A session. Please, if you are ready, let me know. The sound is off.
Are you gonna help me save life, bro?
I must say that we do not own the copyright to this video, but it's being used for demonstration purposes, just for people to know what is happening at the zip line.
What do I do?
So, come this direction. Then there's a handle here.
This is the first time I'm applying my engineering career. Okay.
Yeah.
This side, right?
Got it. Yes. So just set it.
Ah! Aviation engineer. Click.
So you have something we call the walk-around checks.
The walk-around checks,
Yeah, you start checking by looking at the voltage when it's not falling to the low voltage that we don't expect. Yeah, exactly. Then we check the land truth, whether they are seated The nose cone is flashing and secured.
Okay.
I'm going to let you launch the drone, so I'm going to ask for clearance. Are you ready?
I'm ready, more than ready. Okay.
Zipline 639, request for launch. Space is clear, launch is clear, no wind.
Delivering in 5 minutes at Kwana Arco HC.
No wind, space launches are clear to launch after exceptions clear.
Clear to launch. So are you ready to see the light?
Of course, more than ready, man.
So come to this side for me.
Okay.
I'm going to release this button. I'll press this. This will turn green. And you just... Launching 639 now. In 3, 2, 1.
702.
This is medical logistics made easy with just a click.
Please go ahead.
Sometimes you go to the records room to get your folder. It can't be located anywhere.
First, when clients comes, they have to wait for a long time at the OPD. But now with the e-health system, when they come, because the information starts from the OPD. Before they reach the ward, the information is already on the machine.
At first, when you come, what happened was that you come, even if you come early, you waste your time, you won't go, sometimes you come around 6 o'clock and you'll be going to the house around 3 o'clock, which was very bad.
The folders are misplaced, and then we don't have a big place to keep some of the folders. So we don't get some of the folders. We have to issue new folders for those who are already having the folders.
Health is continuity of care that way. Not repeating on them, you want the new old folder, but if they don't get it for you, what do you do? Yeah, you have to restart.
It was not helping us at all. But now with the LEMS, we are going on folderless. You just come, I just add you to the system, then you are off of this. And God willing, inshallah, in the next chapter of this government, complete this project, operationalize this project, so that it will go to impact. Honorable Minister, let me say that it's a 2-day working visit for me, the Ministry of Health. Yesterday, we visited the Lubo Polyclinic, which is a 40-bed facility, together with a 20-bed treatment holding center facility. So in all, you have a 60-bed facility in our tenure. We also visited Takwa in Swahim, where we had another 40-bed facility started and completed by this government. So within the Western region, it comes to commitment to health infrastructure.
Okay, thank you so much. Quality of health in our hospital. It resonated with me very well because I am from that region. And the impacts that this government has for this administration, and this is where we are. If you go to places like Garu, Tempani, Binduri, Kusiga, the largest investment in healthcare delivery is done by this government. And I have seen it. 111. And money go. Because at every corner, any part of your technical teams at the ministry. On that note, ladies and gentlemen, if you have any question, this is the best time to ask. If we see your hand, okay, ladies first. I'm biased. Okay. So we can take the first 5 questions. They permit me to acknowledge our media partners who are picking the feed live. We are on GTV, Joy News, Oman FM, Netu TV, Movement TV, and Kofigo TV. Thank you.
I have 2 questions actually. And the first one is directed to the Minister of Health. I want to ask, when would the Agenda 111 hospitals be commissioned, and also what are their various stages of completion as of now? And my second question will be directed to the DJ of the Ghana Health Service, and that's on the outbreak, the spread in the country. Thank you.
Minister of Health, Honorable Kuboy. In June, when you paid within 28 months, assuming NPP does not in 2025. What are the plans to ensure that the Lagina Hospital is completed? Thank you.
Good morning. Good morning.
Good morning.
Sorry, my name is Abdul Hanan Adam. I work with EIB Network, GH1 TV and Star FM. Minister, this is not my voice, and since you are the health minister,
Minister, so do something about
thank you very much for your understanding. Minister, in your presentation, you mentioned that we are to expect about 51 beds building a separate dialysis center in any part of the country, or you are improving it at the Kuala Lumpur Teaching Hospital. And sorry, I also want to find out what is the debt situation at the renal centers across the country. We understand that there was some HI just a few moments ago. The Director General of the National Health Insurance Authority issued a press statement indicating that an amount of, in addition to what was disbursed some 2 weeks ago, bringing it to a total of 800 million Ghana cedis. I want to find out how much is left and when are you committed?
2 more if there are some hands, Mr. Thompson.
Yeah, thank you. Athamensa from Ghana News Agency. Yes, my first question is with the issue of the culture of maintenance. The minister mentioned a number of hospitals that are ongoing and expected to be completed, but the nation is always complaining about issue with regards to the surgical department of Kolobu Hospital, which the elevators were said to be broken, and then surgeries were rescheduled because of the issue of elevators. And so I want to find out these facilities that are ongoing. Have you put in any mechanisms to ensure that these facilities are regularly maintained so that there will be more nurses than required? That annually we produce about 55,000 nurses, and the issue of third batch of Ghanaian nurses to go to Barbados. Very good, but the issue is, do you have any memorandum of understanding with some of the countries? That is there any MOU so that those countries will pay money directly to the government of Ghana, apart from the remittances that the nurses will bring to Ghana? Is this? That's my second question. And my third question is with
Mr. Please.
The Urology Center.
Allow you to go ahead. Please let him proceed.
Because I am a man and it's good for us as males. One day I may go there for services. But I want to know the cost of this facility, and since it went into its construction, and how we are going to repay this amount.
Thank you. I can see Nana's go. No.
Yes, good morning.
So if you have any question,
My name is Nana Poku from Daily Searchlight. Having worked at NHIA before, and before you came in there, people were saying that the scheme was for some of the service providers were not now, and people were doing all kinds of things, either inflating or deflating or whatever the cost to the NHIA. Being there, having been there, what was the status before I left there? And my second question has to do with the cheap compounds. How many have government consulted so far? Cheap compound in particular. And my third question has to do with
Nana, please, maximum please, 2
very
questions.
Important. And how much is going to cost the country for the Agenda 111 project? Thank you very much.
Okay, I can see one hand at the back. Again, back to you.
Yes, Honorable. I want to ask in respect to the exportation of our nurses to these countries you mentioned, the Barbados and UK, where the third batch will be going very soon. The patient-nurses ratio, that is the best practices experience in other jurisdictions. For now, we are sufficient. It is we have enough nurses who will be able to attend to all these patients before we are exporting our...
No, go ahead. I'll give you the final word if you must. Okay.
Minister, I'm back again, but this time my voice is clear. Minister, you said that government tried to put a cap on admission of nurses, and if we are producing more than we need, do you also suggest that we should put a cap on the admission every year? Thank you.
Thank you for the question. Before we started today's presser, I made several opportunities with Dr. Nsia Sari, who is coordinating the project to provide responses. In fact, barely 2 weeks ago, the financing and everything, and the status and the numbers they are able to commission this year. So please, I will invite the Honorable Minister for his responses, but I just want to give that background information. Thank you.
Question was that we also look at the sewage, and that's serious that we announced, so that we have to do vaccination, so that even as we found one environmental polio virus for which it is not gone into a human being yet. But there are several facilities that have dialysis centers that are provided. It's not just what we see. Koforidua has one. We have some in Wa. I think Bolga one is about. And I spoke to the minister that in addition to all the story there, Ghana has one of the lowest in Africa. That means that the infrastructure or whatever investments are showing, we reported the lowest maternal mortality ever in this country around 2020 thereabout, and it continues to stay at about 110 per 100,000 live births, dropping from about 275 in the last 10 or so years. So it is actually showing. Those are the cross things that I wanted to add, that we have that. Yes, in terms of human resource, as a service, you have some maldistribution. The maldistribution is that you may have the talk of providing some incentive for rural workers will also address that gap. And so in all that, we still have excess number of more nurses, producing more nurses than we need. So that's what I wanted to ask. Thank you.
I think there was another question on the La General Hospital. La General Hospital is an EPC contract, engineering, procurement, and construction contract. And it's supposed to be 36 months contract. So there will definitely be, once we've started in January, we will definitely finish it within the completion period. There wouldn't be any gap. So that is what I want to say to that. And in respect of, one person also talked about the fact that once projects are completed, we allow them to run and we don't have maintenance, like the lifts in the surgical block that you talked about. Currently, what we are doing is that for almost all the projects that we are handling, that we have a minimum of 2 to 3 years maintenance contract embedded in the original contract. So once the project is completed, it has to run for 3 years, being maintained by the particular by the project. So what it means is that as part of our ministry, looking at it from a broader perspective, we've developed what we call the infrastructure strategy. And the strategy articulates clearly that once the project is completed, part of that, we want to try and set up a project maintenance fund, so that once the project is completed, even though it runs, we will try and make sure that we get money from that fund to also complete it. And one other critical thing that we are trying to impress upon our managers, there's no point government giving you the facility and that you allow it to run down before you come back to provide maintenance. So you need to ring fence money from their IGF to be able to target it towards maintenance of our project. But I believe that moving forward, this is what we think is going to be more sustainable. So we don't allow our projects or our facility to run down before government comes to get additional money to be able to contain them. Because, for instance, if you are running a facility using an MRI machine, MRI is a cash cow, more or less. It generates a lot of revenue. So that revenue that is being generated, you should be able to earmark part of that revenue. From the chief compound that we have completed, we have almost close to about 45 of them. But if you refer to the National Information Tracker, assemblies have done a number of projects. I think on the last count, we almost have about 200 chiefs compounds that have been completed by the almost about 250 CHIPS compound that have been completed. Thank you.
Thank you very much. Director General, Dr. Kumabaji was telling me we've also renovated a lot of the health centers, 400 health centers. And sometimes the word is renovation. But if you look at before and after pictures, you realize that it's more or less of a redone. So I would urge Ghana SF so that the visuals are important. Like they say, a picture is worth 1,000 words. So we'll do that. Now, Agenda 111. Now, I'll give some information that, and by the way, this came from the coordinator, so I will not be surprised that the figures I'll mention would have even, there will be better figures than this. But all I want to say is that the project is appropriately called a, so it's a project that has initially 101 district hospitals, but now it's actually 104. This project is supposed to handle 104. They realized that there were some so-called district hospitals, but when they checked, they were not fit for purpose. You realize the health center, the community adds one block, so they've also been onboarded. So the project is supposed to build 104 district hospitals. Region is supposed to be zonal, one for the northern, one for the middle belt, and then one new national psychiatric hospital in Accra. Now, as we speak, out of these numbers, the 104 plus 7 plus 2 plus 1, we have 96 active sites, meaning where you actually have work on, like going on as we speak. We have 94 sites for the district hospitals and 2 sites for the psychiatric hospital. So I think it's Tamale where you have the psychiatric hospital. Those who are watching for Tamale, either I come so we go and visit the site, or you send pictures to the Ministry of Health. It's almost done. For the first time, you don't have to be driven to Accra if you have mental issues. In the Northern Belt, you can have support. So I'm happy to share with you some information. So out of these 96 sites, the projects have been categorized into 3 classes. Are sites between 50% and 70%. And C are those below 50%. So from 1, 2 to 50. Now, $0.4 million. Payments made as of 17th July of this year, $100.874 million. And the date tells you when, I'm sure the new figures will be higher than this. Then outstanding payment is there. In total, for both categories, as at the date I got this sum 6 weeks ago, this government has paid $312,134,789 million. All I want you to pick is that the Agenda 111 thing is real. It's real in terms of government expenditure and payments, and real in terms of fiscal buildings. And I got some of the pictures to be up on the screen. If you go to Pram Pram, good morning to my brother, Sam George. So these are some of the things that I'll say. It is those facilities in category A, ladies and gentlemen, that them are even 80% and above. I know that the Agenda 111 Secretariat is working on equipment, the things that will make Ghanaians enter the building. So if you are watching us, know that the Agenda 111 is not words. It's actually a lot of action. And I think we are, again, the word to use here is courage. Only few have the courage to start over 100 facilities at a go. And not just empty courage, but courage that brings them this far. La General Hospital, initially, some said it was a hoax. Now it's going to the sky. We are saying when. This spirit of it cannot be done, we can kill it. It is possible. We are going to finish the hospital. The contractor is on site. By the way, if you have fears that if we leave, it might not be continued, what's the best thing to do? Is to protect the office. If you have some fears that a change can affect the project, please then prevent change. All right. So, nephrology. Yes, all I know is that we are going to add more beds. Someone was prompting me now. The ministry has a vendor, the radiology center, so that before we enter November, we don't want to wait till December and then someone will think that it's because of something that we are. Before we enter, we should have some surgeries going on in the facility. Dialysis. The ministry is also working with hospitals, especially regional hospitals, to make sure that we help them to place dialysis. I think in Ghana, not all the time you have to pick a lot of money to buy an expensive machine. There are companies that are willing to do what we call placement. So if it's a dialysis machine, if it sells for work through a structured means, it can be placed at, let's say, Eastern Regional Hospital. If they have, the last time when I checked, Honorable Amin helped Tamale teachers about 2 or 3 seats, chairs that you can do dialysis. That belongs to them. Meanwhile, you can do placement where, through guidance from the ministry, structured arrangement, a company can place 10 dialysis machines, 20, and you didn't buy. For every patient to dialyze, when health insurance pays for the dialysis, then you go and reimburse the company. For, let's say, in the next 7-10 years, you have an arrangement. The good thing about placement is that this habit of, in quote, we in the public sector, we are not good maintainers, that one is handled nicely. The one doing placement only gets paid when the machine is working. So if you are supposed to service it every week, they will make sure you shut it down on that day so that it is serviced. Instead of this practice where sometimes, I'm choosing my words carefully, a machine is bought at a very expensive amount, given to a hospital, because they didn't find the money and we are paying through taxes. If it's supposed to work 6 days in a week or 4 days, the machine will work sometimes until it goes off. And then the letter will come to Accra. The machine that you brought has gone off. Like DG said, Mr. Nkansa said, all the proceeds that have been taken from the machine, that one we don't discuss, but it's a machine. So I think, and this one I've mentioned it to some of my directors. Beyond this administration, once we move from it is possible to it is done, there's no connection between the output in the hospital and the things that the managers get. We must move to a place where what happens in the hospital determines what those managing the hospital take home. Immediately, a lot of things will change. If these machines are not working, this is what you get. If these machines work, it's the only way across the world to get people to work. If you are in charge of a restaurant, when you sell food to 2 people, you are paid 10,000 Ghana cedis. If you sell to 100, you are paid 10,000 Ghana cedis. If you sell to 1,000, you are paid 10,000 Ghana cedis. Why are you going to invest energy and time to take care of 1,000 when 2 will give you the same amount of money? It's a rational behavior. So we'll move towards that. But it will be in the next MOU. Yes, when we started with those islands, their grandfathers and ancestors came from here. In fact, they are our brothers and sisters. If you see them, you know that this is your auntie that you know, just like us. So they came to tell us that they have issues with healthcare, we should help them with nurses. So out of this government to government, that's how we were able to get them nurses to support them at key places. So more or less, we didn't tell them pay for the nurse, but they pay their salaries, their rent, everything, and then those people normally would spend and remit. I think going forward, we are trying to shift from just a friend-sister arrangement to what Cuba is doing, where for every, let's say, salary they get, some 5-10% come to Ghana, so that we can also invest in our training, or it can also be a forex for us. Most countries are not now making money only from cocoa and natural resources. We also have to start getting money from human resources. So we are going to do that. Seychelles, you are here. This is national TV, so I can't say much. Director, as you work on the MOU for Seychelles, they gave you advice. how you can make it correct. So please, they might be watching from station, so I can't say what you have to do. But more or less, it's a good advice. How do you make sure renal cases across the country, government owned NHIS is paying for the dialysis? In the future, my prayer is that we can pay for all sessions. For some category, I think they are paying for 2 sessions now. How much is government spending on General 1? A General 1 costs $7.65 billion. $7.65 billion. It's not small money on one project. And by the way, all the hospitals I mentioned are outside our General 1. Director infrastructure, you have to add how much that one. Yes, nurses to doctor ratio. With all due respect, there is a ratio that the WHO recommends for nurses to patients. That most of our own sisters and brothers who do nursing and other health workers, but the distribution is not too correct. It's shifted towards Accra, Greater Accra, Eastern, Ashanti. Then recently someone approached me. I want to stay in Kumasi. Not only Kumasi, Ashanti. I want to be in Metro. They are choosing where they want. So I said, oh, Ashanti might be difficult. Can you choose an adjoining region? He didn't choose a region. Sunyani. Everyone wants to be in the city. And so that is a slight challenge. So if you go to a difficult place and realize that the nurse number is not good, it's not that we don't have the nurses. But as you push, sometimes they also pull. And as for this problem, maybe we have to use some incentive mechanisms to draw people to those areas. When I was in Chebi, my pay was the same as my roommate, who is at Medina. And when he closes work, he gets extra sempa from 3 to 7 all the time. So the doctors, nurses, lab technicians, all health workers outside the big cities, we have to find a way to treat them differently, maybe through salary, so that people on their own can go to Akachi or go to Hawaii, because Hawaii is not the same in terms of what you get as Accra. But as we speak now, a nurse at Lekma takes the same, if you are at the same level, as a nurse who is at the Elubo border and can see Ivory Coast from the hospital. So these are structural things that we have to work at. But in terms of the ratio, I think we are fine. And then finally, a cap on training. The nurses we train, we have categories. So we have diploma nurses being trained in Ghana. We have degree nurses being trained in Ghana. We have specialist nurses being trained in Ghana. And we have certificate nurses being trained in Ghana. And when you check the numbers, sometimes the certificate people are even more than the rest. So you produce 55,000, but half or more need some extra skills too. They are nurses, but at the certificate level. You realize that you produce them, and they have to go and get additional knowledge, like to do other courses. What we have to do is to find a good balance between encouraging those who are running certificates, either to move it to the next level, or to find a way to help and assist to upgrade. If you reset them, it will be a problem. So we have to upgrade. So with the nurses, upgrade is very important, not reset. So once we help to upgrade them, then they are likely to be fit for the world. But as it speaks now, a lot of you don't know, most or some of the nurses we train, apart from Ghana, they can't work anywhere. Because when we started training them, we were training them to fill some specific gaps. So their training is certificate for a particular agenda. Only for us to realize that some of the gaps have now been filled. So this is something that we'll continue to consult so that we see how to give them opportunity. And then on this note, Dr. Da Costa is also doing well to pay them. You know, I think the politics about health insurance, if it stops, it will help all of us. I go to Lekma Hospital to sit in a consulting room. I see a woman who has high blood pressure, diabetes, some back pain, 70 years. I said, Madam, okay, I take care of her. She doesn't pay for OPD, insurance pays. she goes to pharmacy. So I tell them, when you go, come back, just to see what medicine you get. This woman will come to you. She has amlodipine, she has Bendro, these are BP drugs, she has some Brufen, and she has some metformin. She walks home, she's happy. But when you go to the streets, you see political activists argue. Insurance has collapsed. They don't even enter the hospital to see what the woman has. But it is true, there are occasions where, as a result of inefficiencies or some challenges, you go to hospital, out of the 4 medicines, the woman will get 3. She will get 2. She might have to either go to a pharmacy that has health insurance accreditation or buy from the pocket. I remember there was one time I went to one hospital to consult, and then some very simple medicine was not there. They asked that the woman should go and buy. I said, no, as for this medicine, even me, I have some in my car. So it's easy to get this medicine. And then quickly, something was done, they got some. So it's a chain. From the top to the down, we have to monitor the chain, so everybody. But please, with all due respect, journalists, and I've always begged you, you to walk into the hospital. They will not, nobody will sack you. Unless you go and, before you enter, your camera is on. I came to, let's find nice ways, engage with directors. I want to know how patients are doing. Talk to Kumabwaji, so that we all get honest feedback. If you give me honest feedback, we are also going to work on it. If the feedback is absolute propaganda, modernizing the system, it has gone very far. In terms of improving on payments, it has gone very far. One of the key issues, so that prices can move. But sometimes, when people have charged money for a long time, even when you give them real rates, it's not easy for them to stop. So we are talking with the vendors. And please, before I conclude, the NHIS, I've heard the debate. People say it was started by this. Some said NHIS was mutual based. Now, please, small education. When President Kufuor started health insurance, every district had more or less its own health insurance. Let's listen carefully. Managed by its own elders. And they pay hospitals by themselves. But in every part of Ghana, the scheme was there. That's what Kufuor started. So although it was a district-run scheme, it was a national scheme. Why is it national? There was no situation where when you go to Nkoko, they don't have it. Everybody had it. What we did, and some people say that's what means they brought insurance, that we changed the law so that instead of there being 275 independent states, they all are one. I nearly say under one thing. They are all one. One, as in they have one board that sits here. They have one management and CEO. But it's the same schemes that now report to the region and the center. If you have 275 units, then it was not even 275 districts. Let's say you had 170 districts who were reporting to their own bosses. And now we've dissolved the bosses so that once it was nationalized, if I have a card in Teshi and I fall sick at Nkoko, I can walk to Koko and get care. But before we even did that law, the law allows you, if you are in Koko scheme and you visit Teshi and fall sick, you can show your Nkoko scheme. There are administrative things that could be done to make sure that Nkoko, because they collect their money alone, can send money to Lejokuku scheme. So all that was done was to move from one step to the other. You improve every program. If you have come to make the law, of course, all of us made the law in Parliament, to remove all these parliament that made the independent states one state is what brought you. So some of these things doesn't help. President Kufuor, I believe, is watching. Let's celebrate bold people who said we cannot live in a country where you go with your child with malaria, a doctor knows it's malaria, because you don't have 1 Ghana cedi, go home and die. That was the situation before Kufuor became president. Let's celebrate those who had the courage to say that this is possible. Let's get away with this wicked system where the rich have their children taken care of and the poor suffer. That's the kind of courage that made Dr. Friye, President Kufuor's first minister. He and his team traveled to oversight on a plane. All this courage. Someone says that it is in Parliament where you debate and you have the program. So please, let me salute President Kufuor. We gave birth to the national insurance. It's our baby, and we're going to take care of it until it becomes very old. I thank you very much.
Honorable Minister, our friends from the media, ladies and gentlemen, thank you so much for today. I think Dr. Okoboy should be coming here quite often. I thought he would do just 1 hour and go, but he seemed to have enjoyed the platform. So please, specific. Important. When we leave vacuum, that is where rumors, speculation, misinformation fester. But the moment you are a responsive minister, if there is any issue, you are willing to come and clarify and take questions, it makes the work easier for all of us. So I want to thank you so much to spread the word. It's very important that people know that work is ongoing at the site of La General Hospital. It's important that coming up strongly, and another one in Kumasi, maternity and children's block at Komfanochi Teaching Hospital. Thank you so much for making time today. We hope to see you another time sooner than you might think. And I want to thank our media partners for picking this briefing live. GTV, Joy News, Movement TV, Netu TV, and Oman FM. Thank you, and enjoy the rest of the day. Oh, and once again, let me acknowledge my team. You see, I'm here with the beautiful Lavemisa, and earlier on with Misa to sign for us.